Hi there, I'm Taryn. I'm going to be your nurse today.
Nice to meet you. I'm Gertrude.
Nice to meet you as well. What brings you into the clinic today?
I've been really tired lately. I noticed I've lost some weight. I've had a low-grade fever and my body has been really achy.
Okay, well let's run some tests to see if it could be the flu or COVID. Have you been out of the country recently?
No, but I did just get back from vacation with my boyfriend of 4 weeks. We're really in love.
I see. Does your boyfriend have any other symptom or have any of these symptoms?
Yeah, he does, but he doesn't like coming to the doctors. He said he's felt sick for almost a year now, but figured it was just because he finally stopped using heroin and decided to turn his life around. He used to be addicted to drugs, and he and his friends would all pass around the same needle when they wanted to get high together.
Wow, that's quite the story. When did your symptoms start and how long have you been sexually active with your boyfriend? Do you use protection?
My symptoms started about a week ago, but my boyfriend and I were hooking up before we became official. So maybe a month or two, and no way. We both hate condoms. They're so lame.
Interesting. Well, the doctors ordered some more tests to see what might be going on. Runs tests. So your test results came back and it looks like you have human immunodeficiency virus or HIV.
Well, what can I do now? How do you get rid of it? How do I tell my boyfriend?
I will have the doctor refer you to a specialist in the treatment for HIV. While waiting for treatment to run its course, you will have to abstain from having sex, especially with any new partner, as well as let your boyfriend know that he should come in to be tested as well. And will also need to abstain from having sex or sharing needles with anyone until it is determined that he does not have the disease or that the disease is treated.
Wow, that's a lot. Am I going to be okay?
The sooner you start treatment, the better chance you have at living a pretty much normal life. Let's make an appointment for tomorrow for you to meet with a treatment specialist. They will be able to explain everything you should expect from your next steps in the process. I'll also give you some information about HIV/AIDS so you can have a better understanding.
Thank you, nurse.
You're welcome. Please give us a call if you have any questions or concerns.
I will, thanks. So today I'll be guiding you through the process of HIV testing, particularly after a potential exposure. It's natural to feel anxious, but understanding these tests will help you know what to expect and how they work. Let's start with the HIV antibody tests. These tests are designed to identify antibodies to HIV in your oral fluid or blood. These are available as a rapid self-test, but the key thing about these is that blood from a vein can detect HIV sooner than blood from a finger stick or oral fluid. But remember, it can take anywhere from 23 to 90 days after exposure for these antibodies to be detectable. And these tests are routinely used for initial HIV screening. Next, we have the antigen antibody tests, and these are more sensitive than the ones I just mentioned, the antibody-only tests, and they can detect HIV earlier in the infection process. They look for both HIV antigens and antibodies. If performed on blood from a vein, they can detect HIV as early as 18 to 45 days after exposure. For tests done on a finger stick, this window is usually about 18 to 90 days. And these are recommended for lab testing and have become the standard initial HIV blood tests as they have a 99% accuracy rate. Lastly, we have the nucleic acid test, or the NAT, and these tests identify the virus in your blood and are typically able to detect HIV 10 to 33 days after exposure. They're particularly useful for those with recent exposure or early symptoms of HIV but have tested negative with antibody or antigen antibody tests, and NATs are typically used as confirmatory tests for HIV. Understanding these steps is crucial in managing your health, or these tests is crucial in managing your health. Remember, our medical team is here to support you every step of the way, and don't hesitate to ask if you have questions or express any concerns you have. Thank you for your time and take care.
So now that we have confirmed your diagnosis and you've had some time to sit with it, I'm going to kind of explain what HIV is. So HIV is a very serious illness that targets certain cells in your immune system. HIV can be fatal if not treated right away, and it can be passed through bodily fluids like blood, vaginal discharge, or semen if the person still has a large amount of the virus in their body. Having unprotected sex or sharing needles with an infected person is the quickest way to spread HIV. Do you have any questions about that?
No.
Okay, I'm going to send in your treatment nurse and she's going to go over your treatment options.
Thank you.
Hi there, my name is Cheyenne. I'll be going over the medications that will help you treat your newly diagnosis of HIV. We use a treatment called ART, which is an antiretroviral therapy and is a key player of treatment of HIV/AIDS. It is not a cure, but will help you live a longer and healthier life. It as well reduces the risk of transmission to others. ART consists of several classes of medications that work together to control the virus, and key players in ART include NRTIs, which just act as guardians preventing the virus from converting its genetic material. We have NNRTIs, which are disruptors hindering the virus replication. We have PIs that act like stop signs, interfering with crucial enzymes to hinder viral particle production. We have INSTIs, which act as gatekeepers, blocking the virus from integrating its DNA into yours. We have fusion inhibitors and chemokine receptor antagonists, and they act like bouncers, preventing the virus from entering your cells. The goal of these medications is to manage HIV and AIDS by reducing the viral load, boosting CD4 cell counts to strengthen the immune system and slow down the progression of the disease. You will typically start on a combination of 3 HIV medications 2 from different HIV drug classes for your initial HIV treatment, and you'll be on these medications for the rest of your life. The effective management of HIV, it is crucial to take the medications as prescribed by your healthcare provider. Like any other medications, there can be side effects, so it's important to communicate openly with your healthcare provider so that they can help manage any side effects and adjust your treatment plan if necessary. And always remember that you're not alone on this journey. We're here to support you. With proper treatment, you can live a fulfilling life, and always feel free to reach out with any questions or concerns. Thank you for being here.
Hi Gertrude. So I see that you got some information regarding your diagnosis of HIV, and I'm just here to give you some extra information that is aside from the disease itself. So one of the important things that you want to consider with this disease is that you want to establish care with an HIV specialist. To make sure you're getting the proper care, you have to make sure you adhere to your medications, any regimens that your doctor prescribes. Another important thing to do is to make sure you eat healthy, you get good quality sleep, you exercise regularly. This is going to help boosting your immune system, because unfortunately some of the drugs that we use to treat HIV can cause you to be immunocompromised. And you also want to avoid smoking, doing any drugs, and consuming any alcohol as much as possible. Another important fact is that you also have the responsibility to disclose your HIV status to anyone you're planning on having sexual intercourse with. This is the law, specifically here in Nevada. It varies from state to state, but it's also the right thing to do. So make sure you don't share any dirty needles. You should try to avoid engaging in risky sexual behavior. And another important portion of this treatment is to consider attending therapy sessions, either on your own, with your partner, with some family. It could be very beneficial to yourself and anyone around you. And if in the near future you would decide to become pregnant, make sure you discuss your options and risks with your doctor before you make that decision, and be aware of the modes of transmission for this disease. And as for your partner, you should also be getting tested. And since your family is here, I'm also going to have a small conversation with them. And we'll actually just take it outside, and then we'll be right back. So I did talk with your sister a bit about her diagnosis of HIV, and I wanted to have this conversation separately because it can be very hard on the family sometimes. So I just wanted to go over some things so that you guys could best support her. And one of the things I wanted to mention is to make sure that you try to be very cautious of the way you speak to her. Don't shame her for the diagnosis, don't isolate her. Try to be supportive and understanding. You know, this obviously was not intentional. And if you would all and the patient be willing to attend therapy sessions together, that could also be very beneficial. And then it'd also be good for you guys to sit in for the educational portion of her visit, so you guys can be aware of any modes of transmission. Do you have any questions for me?
No.
Okay.